Hi, everybody. Welcome back. I'm Josh Packard, Executive Director of Springtide Research Institute. We've been bringing you this series of videos about sort of when you do reach out to young people, which is what all the research that we've been doing suggests that you should be doing. How do you do that? What exactly do you say? And to that end, we've got Sarah on right now. Sarah's on our research advisory board, and she's been working with young people for a long time in highly relational ways. And Sarah, why don't you just sort of describe what your role is?
Sure. Thanks, Josh. So I am the clinical director at Out Youth, which is a center that serves LGBTQIA folks in Austin, Texas. And so I oversee all of our clinical and social services, everything from individual and group counseling to case management, just a variety of services to meet the needs of the folks we serve. And we started age 12. So we serve a lot of middle school and high school age folks, as well as transition age young adults, ages 18 to 23 as well.
Which is right in our core group audience. I mean, not our core audience, but the core group that we're interested in at Springtide, 13 to 25-year-olds. And I want to talk with you, Sarah, because this moment that we're in right now is sort of a crisis moment. As people are, some of them are adjusting to stay-at-home orders, but home is not always a great place for a lot of people. And you've got a lot of experience, of working with youth who come to you in crisis moments. And so if we're sort of thinking about like, what is one thing we should be saying or maybe even not saying? I mean, I think that one of the things my friends who work in like trauma-informed backgrounds is like, don't tell them not to worry. And I was like, oh, that's a really useful thing to like know not to say. And so I'm just sort of curious from your perspective, like if we're reaching out to young people, what should we be saying?
Yeah, and I think that's a perfect segue to what I've been thinking about and encountering as I've been talking to young people is really, there's a phrase that I really like, name it to tame it. So it's this idea that if you just kind of ignore that anxiety or those seemingly negative feelings that you might be having, then they're going to pop up in other places. They're going to pop up in your body. They're going to pop up in your interpersonal relationships. And so I think that's huge right now, is really just acknowledging the tough feelings and thoughts that young people are having and not trying to immediately jump to platitudes or hopefulness, like really just trying to be with them in that moment of anxiety and grief. I mean, I think a lot of young people are thinking about the fact that maybe they're not going to go to that prom. We had to cancel our LGBTQIA prom that we've been holding for 30 years. And we know that like youth had already planned out their fabulous outfits and that's going to sit in the closet for right now. So I think just really acknowledging that grief and the anxiety that they might be feeling is super important.
Yeah, I totally agree. I mean, even from my students at the university where, I've been trying to be preemptive about that and to just, before they even bring it up, to just say like, I work with a lot of first generation students. And so when a student graduates from my university, it's often a family that's graduating because of all the work that's gone into that. And just been really straight up with them to say like, this is hard. Like, I know y'all are going to get a separate graduation ceremony in December, but I get that that's not the same as what you've been planning. And I think, for so many young people who feel like not just unheard a lot of times, but often unseen, to have somebody who isn't like trying to cover up their pain or even not even trying to put it in context, because like, is prom the same as like having somebody who's actually, dying because of COVID? Like, no, it's not the same, but it's really like, it is also important. And so like, I think that tendency on my part can be like, well, at least you're not like really sick, right? Then like I tamp that down because that doesn't seem helpful, right?
Yeah, and I think that's a normal human reaction in a lot of ways. So I want to validate that. And, there's all this sort of comparison that can happen. And I think having gratitude is really important as well. And, recognizing one's own privilege in this situation, that's important perspective sometimes to invite too. At the same time, I think there's some understandable feelings of anger that folks have. Especially, I think the generation of folks that I work with, whether they're, 16 or 21, they're also really thinking about things like climate change and feeling some anger about that. And they're thinking about, responses to COVID and feeling some anger about that. And I have a young person who has a disabled parent and who, parent had those symptoms, couldn't get a test for COVID, so couldn't go to work for 2 weeks. So I think there's just a lot of like, understandable feelings of anger right now that is also really important to just make space for and to validate.
And you don't have to be a therapist to do that. You're saying that it's important for any adult to do this work with a young person, and they can.
Yes, I would agree with that.
So the other, one of the issues, a lot of the people watching this are going to be people who work in like direct ministry situations, like they're working at churches, synagogues, et cetera, and they run youth programs and things like that. And so while I have you here, I was wondering if we could just talk a little bit about what it means to navigate these as safe spaces. So if we're calling for people to be in relationship, there's been a lot of scandal, obviously, around religious leaders who have not acted appropriately, which is a very small minority of them, but obviously the damage for those things is huge and significant. And it has made people think twice about the relationships they enter into with young people, and I totally get that. And I think that we should be sort of checking those things. You've navigated those, from a therapist perspective, and if we're asking people to be in relationship and to say, like, name your pain, and like, it's possible that we might be hearing some things that that are sort of private information. Do you have any tips or guidance for how we might navigate those situations? And I mean, obviously all the normal protocols that you get from your workplace is still are in place here. So it's not like we're looking for, a set of rules from you. But any guidelines that you have for how we can think about those?
Sure. And I think I'm lucky in some ways in that being a therapist, I do have very specific kind of ethical guidelines that I have to follow. And so one of those things is obviously informed consent for our services. So, folks are pretty clear that there's like risks and benefits for therapy. And, in the state of Texas, if a youth is under the age of 18, the parent has to sign a consent. But then we also go over a youth assent, and they have to buy into this idea of, there's going to be some risk involved with sharing very personal things in therapy. And sometimes things get a little tougher before they get a little bit easier. So I think I feel lucky in that way, because I know some ministers may have some sort of guidelines, either from their workplace or from, their larger body of their church. But it maybe isn't quite as cut and dry. And I will say, like, even with all the structure I have around my job, there's a lot of gray area that pops up, and a lot of risk that we're taking when we're entering into relationships with young folks. And I think just really having a good sense of your own boundaries and knowing that boundaries are the most loving thing that we can enact, even though it doesn't feel like it sometimes. And I think also knowing your limits and knowing kind of resources and places to refer young people. So if you don't feel quite equipped to address something maybe a little bit heavier, or an issue involving safety with a young person, just really being aware of the other resources in your area. I will say, actually, to this point, that I'm involved in a church community, and their lovely youth minister, who does a great job, has reached out to me sometimes for tips and for referrals. And I have a youth in X crisis. Like, what would you recommend? And we just text back and forth, and I let her know the resources available in our community, and we have a really open line of communication in that way, because things with youth can get sticky in those relationships.
Yeah, I think that's a really smart, making sure, I think everybody probably, or a lot of places probably have that list of resources, but dusting them off, making sure that they're fresh, making sure that you keep lines of communication open with those, because this is a heightened time. I think that we're going to, home is, like we said, always a safe place for a lot of people who are spending now, having to spend a lot of time there. And so it's entirely possible people are going to run into this, more and more as they move forward. And you said something there about like boundaries being, like this really loving thing that we can do. And I was just recording a podcast. So we have this Voices of Young People podcast where we get 13 to 25-year-olds to talk about the data and belonging, about how that shows up in their own life. And one of the young people who actually did the music for the podcast, we were sitting down to do an interview, and the whole time that we're communicating, because he's 13 or 14 or something, so really on the low end of our age range, the whole time we're communicating, like, it's a group text between me and his dad and him, and his dad is CC'd on all the emails. And at least at the beginning when we were recording the podcast, his dad was there and we said hello, and his son was never put out by that. Like, I thought it was going to be this super awkward barrier of like, why is my dad always have to, obviously it doesn't have to be always and forever, but certainly at the beginning, I wanted to be really upfront of like, if you want to say no, like, I'm not contacting your child without you knowing. right? But I was surprised. It felt like, at how normal it was. And I think there can just be a lot of anxiety around this, like, well, will the relationship be artificial or weird if they think their parents are looking? But like, I think young people are just so starved to know that somebody's looking out for them that they won't
Mhm.
even, you know, they won't even bat an eye. So you're right. Like, these boundaries are not necessarily impediments. They can be just part of the, like, normal things that we do, and people can see them as really healthy.
Absolutely. Yeah, I totally agree. And I think we have to remember that parents can be incredible allies as
Hmm.
well. And so, sort of bringing them into the process, that's been a sort of ongoing and newer revelation for our particular
Sure.
agencies. We work with LGBT young people, but during this crisis in particular, we've really been thinking about that and really wanting to make sure we're reaching out to trusted adults. And we use email for some of the things that we're sending out, like consents to take part in our virtual programs now. And, the youth aren't always checking their email. So
Right.
we bring in the parent because we know they really want to participate in this. But sometimes it's just easier logistically to bring parents in at a certain point. And, young people can be absolutely fine with that.
Absolutely. Well, Sarah, thank you so much. This is certainly an interesting time for us all right now, and I really applaud and encourage the people who are really, leaning in very innovative ways to bring and pivot towards relationships. And this really, because their programs have, sort of gone away, and so that, this is what they've got left. So anyway, I want to say thank you again, Sarah, and I look forward to more of these conversations in the future.
Of course. Thanks a lot, Josh.